Hi, I'm Paul Wright. Welcome to this presentation of rehabilitation, core conditioning and personal training using the Swiss ball. A couple of words of warning. This presentation is not meant to replace individual exercise prescription. If you have specific medical conditions, please see your physiotherapist or sports physician before continuing any of the exercises in this program. If you have any pain during the exercises, please stop and see your professional as well. I hope you enjoy the presentation. So why use a Swiss ball? They've been around in physiotherapy for many, many years. I know I've been using them personally for over 10 years now, and they've been around a lot longer than that. The general benefit of a Swiss ball compared to conventional exercise programs is the unstable nature of the equipment. It provides, when you're sitting on it, lying on it, or whatever you're doing on it, it makes a lot of muscles work a lot harder than they normally would. This increased neural activation is excellent as a rehabilitation tool and really good in a personal training or gym setting. A couple of things to be aware of when you're buying a ball. You have to make sure you get the right ball size. One of the key issues when you sit on the ball is to make sure from the seated position that your hips are slightly higher than your knees. Now if the ball is too low, you'll tend to round into the ball, losing your lumbar curve. The other key is probably to think about keeping your femur pretty close to parallel to the floor. If you have a back condition or using the ball mostly as a chair or sitting on the ball, you can have the ball a little bit bigger. The slightly higher ball encourages a slightly greater lumbar curve, which again takes a bit of pressure off the lumbar discs. As I said, beware of the ball that's too small or underinflated. It will round you forward too much from that position. Always make sure you buy an anti-burst Swiss ball. Get some of the cheaper quality balls, if they punctured, will actually burst, which is quite a nasty thing to happen. The anti-burst ones, if punctured, they go down slowly, so you don't tend to fall on your face, which is very useful. A quick tip on inflating them: if you do buy a ball that is in a deflated state, take it to the petrol station or pump it up at home, but pump up about 3/4 to its correct tension. This is a 65 centimetre ball I've got with me at the moment, and you can feel, or you can see when I push it in, that's pretty much correct tension for me. If it was too deflated, I would sink on the ball and it would be very, very stable, which removes the benefit of it. If it was too pumped up, it would be too unstable. Again, for me, that's the correct tension. When you first buy your ball though, pump it up about 3/4, because overnight, the elasticity of the ball will increase, you lose some pressure, and put the final bit of air in it the next day. A couple of safety issues for you. When you're exercising on the ball, as you'll see through this presentation, we're on a wooden floor here today and we've used a mat to make it a bit more stable. Wooden surfaces tend to be a bit slippery. If you're lying on the ball, there's a tendency for the ball to slip out from underneath you. Be aware of that. Again, make sure your ball is on a nice stable surface when you're using it. The other key point is to make sure when you do your exercises, don't go outside your comfort zone. Make sure you're able to maintain good control. If your form lapses, we don't want that to happen. So never tolerate poor exercise technique. And I'll stress that through today's presentation. Okay? Good luck with the exercises. Now, before we actually get started on the exercises that we use on the Swiss ball, I want to spend a few moments just mentioning core stability and what it's all about. The last 5 to 10 years has seen a big amount of research done on core stability and what it all means. Really what we're talking about is stability through the midsection, how well you can stabilise the base of your body while your limbs are moving in space. Before I go into that though, be aware that you're only as good as your weakest link, which means if I'm in a standing position, I may have excellent core stability through my midsection here, but if my hip is unstable, or my knee is unstable, or my ankle is unstable, that makes me inherently prone to injury. So whilst core stability is important, it's not the be-all and end-all. It's important that the whole mechanism is looked at as a stable entity, not just how well you are held together through the midsection.